Hi, and thank you for tuning in. My name is Whitley Smith, and today we're going to have a talk about aphasia. We're going to talk about what it is, how it's caused, how it's treated, how one with aphasia can make their life better, and how someone who's dealing with a person with aphasia can help to facilitate a better communication experience. So now that we have a bare bones understanding of what aphasia is, let's look into who it impacts and who it affects. A lot of times with certain diseases or disorders, you'll look and you'll say, well, this mostly happens to older people, or this mostly happens to younger people, or people of a certain race, people of a certain background. But aphasia pretty much can affect anyone. It's not a respecter of person. We'll look into the cause of aphasia a little bit later, and that will help us better understand why it affects so many people. To just give you sort of an idea, aphasia stems from brain damage. Like we talked about earlier, damage in the left language hemisphere, that can happen to anyone. A toddler can fall and hit their head. An elderly person can take a fall. You can have a car crash. Anything just about accident wise can affect any person. And that's why aphasia does have such a wide reach in who it impacts. But we'll look a little bit later in the slide and we'll notice that typically you'll see an older demographic of individuals with aphasia. And the reason is that we'll talk about later in the slide will kind of explain why that demographic is primarily affected. So let's continue to build on what we already know. We know what aphasia is. It's the lack of ability to speak or comprehend or both. And we kind of know who it affects. It pretty much can impact any and everyone. But let's sort of look and see what aphasia looks like. So, for a speech pathologist, typically when we go and look at aphasia, we're going to do a battery of tests to analyze a person's receptive abilities as well as their expressive abilities to communicate. That battery of tests, outside of what we see as professionals in the naked eye, will help us give a concrete it'll help us give a concrete explanation as to this is definitely aphasia. So in two ways we look at this battery of tests has shown us it's aphasia, and just by interacting with this person it's aphasia. But for a person who has no speech background, for just the naked eye, let's kind of look and see what aphasia looks like and how it affects people. So because aphasia is such a sensitive disorder, it can be caused by any sort of brain trauma, be it a fall or a wreck. It's probably going to have a different severity and a different impact on each individual that it touches. So when you're dealing with a person with aphasia, this is what they're dealing with. This is their side of the tracks. This is what's hard for them. Understanding what other people are saying, like we said, or using the right words to express their thought. The thought is there. What they want to say is there. I want a cookie is in their brain. They're just having trouble getting it out. For them, reading can be frustrating. Writing can be frustrating. Even things like using gestures to say, come here, or go over there, or pointing to this or that can be affected. Drawing pictures can become a really, really difficult task, even if it's just a circle with a smile or a clock. And using numbers or doing math in any sort of way, be it on by hand or using a calculator, can also sort of become jumbled for a person that's having difficulties with aphasia. So in the previous slide, we went over some of the difficulties that people with aphasia have as far as reading, writing, gestures, pictures, understanding, expressing, things of that nature. So it's important to note that a person with there are several different types of aphasia. There's anomic aphasia. That's just pretty much a difficulty with getting out a word or naming something. Let's say there's an apple, keys, and a strawberry on the countertop. And they see the strawberry, they know it's a strawberry, They can say, get me the, they just can't get that strawberry out. That's why it's important to note that aphasia varies in severity. So someone with mild form of aphasia, like I just said, may have anomia, which is trouble finding words during conversation. And some people whose language abilities are severely impaired, that's known as global aphasia. So let's go back and think a little bit. We talked about how aphasia can be brought on in different ways. We talked about that a little bit. And we talked about how it can impact different people of any race, age, creed, whatever. So, knowing that it can impact different people, you have to know that it can impact those people individually. Every case of aphasia is going to be different. There will be similarities between cases, but no two cases will ever be alike. A person who just has the naming portion, just anomia, and a person with global aphasia will have all of those or several of those things that we talked about previously. Now, it's also important to note that aphasia has nothing to do with an intelligence factor. A person with aphasia is just as smart after their brain injury or whatever brought on the aphasia as they were before. The knowledge is there, the expression just isn't there. They can usually be coherent with their thoughts and they can have meaningful ideas that they want to share. They're just having a lot of trouble getting it out. So let's pile on a little more. We know that aphasia can affect so many of our receptive and expressive abilities, but aphasia can also run concurrent with other conditions as well. A lot of the common ones that you'll see is aphasia in conjunction with dysarthria or slurred speech, apraxia, or the inability to move their face and tongue muscles correctly to form the actual words that they want to say, or just general cognitive impairment. So aphasia can be a really big deal, as we already know, and it can also be tacked on with other disabilities that make communication even more difficult. So let's dive in a little more. I talked earlier about it affects different people different ways, and how, sometimes we have these ideas of certain diseases or certain disabilities, inabilities, and things of that nature that they'll affect primarily one segment of the population or another. A lot of times when you look at aphasia, you're going to assume that that's something that would happen to an older individual. And typically the reason for that is because, as you can see by the graphic, 85% of aphasia is caused by stroke. And you don't hear about a lot of young people having strokes. I've heard of people in their 20s having strokes. The youngest person that I know personally that has had a stroke is 33 or 30. I think they're 34 now. I think they were 33 at the time. So 85% of aphasia is caused by strokes and typically strokes are seen in older individuals. The other remaining 15% of aphasia is brought on by brain injury, brain tumors, neurological diseases and conditions and things of that nature is what brings on aphasia. But all of these things share one thing in common. They impact and disrupt the language portion of the brain, which is the left hemisphere. And that particular damage in the brain is what causes the aphasia. So no matter what the overall cause, be it stroke, injury, tumor, or disease, they all work to bring about the aphasia. So what does aphasia look like? There are two main types of aphasia. There's fluent or receptive aphasia, which brings about difficulty understanding language as well as producing it. And then there's non-fluent or expressive aphasia, which is just difficulty producing language. So the big difference there is some people have difficulty solely with just producing language, while others have a disability or an inability to understand language and produce language. A person with receptive aphasia often has trouble following directions, answering questions correctly, understanding the meaning of words and sentences, and following a conversation. Now, a person with expressive aphasia has difficulty coming out with the right words for what they have to say. It may be hard for them to say yes or no as they intend to, or to speak easily at a normal speed. They may even have trouble repeating what somebody else is saying. Many people have a combination of receptive and expressive aphasia, which might be called mixed aphasia, or when it's really, really severe, it may be called global aphasia, like we talked about earlier. There are other names for types of aphasia depending on the relative strengths and weaknesses of listening, speaking, and repeating, and those strengths and weaknesses are analyzed by batteries of tests used by speech pathologists to put a pinpoint on what type of aphasia an individual may have. Fluent aphasia may be called Wernicke's, transcortical sensory conduction, or anomic aphasia, while non-fluent aphasia may be called Broca's or transcortical motor aphasia. There are even subcortical aphasias caused by lesions deeper in the brain. A person with aphasia may have a tendency to get stuck on some words or ideas every time they come up. They may use made up words or actual words strung together in sentences that make no sense to anyone else. Some people with aphasia are still capable of swearing when they want to, so you may hear perfectly clear swear words, while other words are less recognizable. Aphasia can be a fluctuating condition. Sometimes the person's able to speak clearly in whole phrases, and then they lapse back into a difficult ability to speak. So, this talk is for anyone who wants to learn more about aphasia, whether they have it or not. Let's look into what goes on once you've been diagnosed with aphasia or you know someone who's been diagnosed with aphasia. This may be good information for you or good information to pass along. So, a lot of times people with aphasia may have feelings of isolation. It's important to know that you're not alone. There are about 2 million people in the US, just the US, not including all over the world, but 2 million people in the US with aphasia. That's more than Parkinson's disease. Participating in speech language therapy may help people with aphasia improve their communication skills. So we know that once you've seen a speech language pathologist and they've explained to you about your condition of aphasia, they can also assist you with making communication easier. Aphasia treatment is individualized and it addresses the specific needs and areas that have been identified during assessment that need to be fixed. It usually includes a specific goal identified by the person with aphasia and their family. When treating people with aphasia, typically a speech language pathologist makes sure to capitalize on the strengths and address the weaknesses. Therapy is hard. Therapy can be frustrating. You're in a different place in life than you've ever been before. So it's important to make sure to capitalize on the things that you can do and know that because there are things you can do, there will always be things that you can do to compensate for those weaknesses that have been accumulated by the aphasic condition. A SLP, speech language pathologist, facilitates activities and helps you participate and teaches you new skills to compensate for some of the things that have been taken away by the condition. As a person with aphasia, there are some things you can do on your own outside of therapy that will help you better communicate. Let's go through a couple of those. So we want to minimalize. When you're talking to someone, try to minimize the background noise. Now, that's not always possible if you're out and about talking to someone in a public setting, but if you're at home or in a place where you can step away to a quiet area, try to minimize background noise. Turn off the TV or go to a space that's more quiet. Think about what you say before you say it. Sometimes when someone asks a question, you want to right away spit fire and answer back. But it may help a little bit to just think about what you say before you express it so that you can communicate more fluently. You also want to try and use facial expressions and gestures like pointing. You can also, if your condition allows, try to write in order to express or get your message across. Remember to go easy on yourself. It's clear if you have aphasia, we know that you're trying your best. And you know, most importantly, that you're trying your best. So don't shy away from conversations. Go easy on yourself. If you need to explain to someone what your condition is, let them know. Hey, I have aphasia. I might talk a little bit more slowly. Don't interrupt me. Don't try to get my words out for me. Just give me a minute to talk for myself. Also, practice, practice, practice. Talk as much as you can. I know it may be awkward if you have aphasia and you might not want people to know, or it may just feel weird trying to talk and you've never had trouble getting your words out and now you do. But still, practice makes perfect. That old adage never changes. If you can't get a word out, just try to describe it. Try to work your way around the word. Let's say you want a ball, a basketball, and you just can't get that word basketball out. It's okay to say, give me the round thing. It bounces, goes through the net, hoops, LeBron James, NBA. Eventually, we'll get to what you're talking about, and that's okay. The most important thing is that you're getting your message across. Avoid important conversations when you're tired or emotional. Even for people who are normally fluent, when you're tired, your words get slurred or just don't come out right. When you're overly emotional or crying, sometimes the words are hard to find or hard to get out correctly. So in conjunction with aphasia and emotions or important conversations that weigh heavy, or you're tired or something like that, it can become even more of a struggle. So if you can, put those conversations on the back burner and save them for later when you're in a more fluent space. And lastly, join a support group for people with aphasia. You are not alone. Like I said, there are about 2 million people in the US alone, not even the entire world, just the US, that have your condition. You're not alone, and you're not the only one. There are support groups all over the world. If you can't find an in-person support group, there are support groups all over the internet that you can join that may make it easier for you to share some struggles, pick up some good habits, and learn some best practices among other individuals with aphasia. We discussed what people with aphasia could do to better communicate and be heard and to express their thoughts and feelings. But there are certain things that you can do as a person who's normally fluent to help a person with aphasia express themselves more clearly. You may have a family member or friend with aphasia, or you may have patients with aphasia, or you may interact with people on your job or wherever. They're all over the world. You may interact with someone anywhere that has aphasia. So it's important to remember that people with aphasia can still communicate, especially if they have a little help. Here are some things that you can do to make communication easier for them. You want to limit your conversation to one person at a time. Be sure your surroundings are quiet and free of distractions so the person with aphasia can hear and focus on you. A lot of times when we're in group settings, you're talking amongst friends, there may be 5 or 6 people there together, and if you're dealing with someone with aphasia, you want to make sure you key in and limit your conversation to just them so that they have your full attention and they don't get stressed out and feel like they're fighting to get their thoughts across and fighting for your attention. Begin the conversation by telling the person what you want to talk about. Knowing the topic can help them understand what you're saying. You want to speak slowly and naturally. Don't shout or raise your voice. Use short, simple sentences, but be careful not to talk down to the person. When necessary, repeat yourself or rephrase your comments. Use facial gestures or expressions and point to help make yourself more clear. It's important to know that intellect isn't impacted. Like I said earlier, the person who's affected by aphasia is just as intelligent as they were before the aphasia happened to them. So you don't have to dumb down your conversation. Just speak more slowly, more clearly, and define your topic. As you proceed through a conversation, stop and look to summarize and summarize what you've said. Make sure they've understood. You know when someone understands what you're saying, you'll get a head nod, you'll get an okay, an uh-huh, and you also know a confused look, like a raised eyebrow. So instead of just talking and being distracted by something over in the corner, good eye contact and maintaining a good knowledge of what the other individual that you're talking to's facial expression is will help you know that the conversation is flowing and is going well. Talk about familiar subjects. Family photos can help start a conversation or move it forward, or just ask yes or no questions if you don't know that you have a familiar subject in common with the person that you're speaking to. You want to give a few choices if you ask a question. So don't just say, if you're out with a person with aphasia and you're going to get a pizza, you don't want to say, do you want cheese? Or what kind of pizza do you want? A better way to phrase that would be, do you want meat lovers? Would you like veggie, or do you just want cheese? Give them options and they can say either veggies or cheese or meat lovers, or if they can't quite get that word or phrase out, they'll just say the second one or the first one. You see, it kind of gets a little easier. Encourage the person's efforts to communicate, but admit when you don't understand what they're saying. Don't assume that you know what he or she means, and it's okay to offer help by gesturing or kind of guessing for them. Sometimes, I don't always advise trying to get the person's words out, but after they've made a valid attempt and they seem a little bit frustrated, then go ahead and just give them cues like, do you mean XYZ? And they'll say yes or no. Also, remember, encourage them to communicate. You have to put yourself in their shoes. It's frustrating. Imagine for a day you had a piece of tape around your mouth and you couldn't say what you wanted to say, but you still had to go to work or to the grocery store or wherever it is that you go. Imagine how frustrating it would be if you can't say, I'm too hot, or that air is too cold, or I need to go, or I have a question, or I like this. Just imagine what life would be like if you couldn't express how you felt. So try to put yourself in their shoes. And if they're having trouble getting a word out and you don't understand, you don't want to patronize them by just saying, yeah, I understand, because their intellect is still there. They know if you're not following the conversation, even if they can't get their words out quite right. And lastly, don't make the person try to speak perfectly. Aphasia can be frustrating and tiring, so give the person plenty of time to express themselves. Don't rush them in conversation. If they make several unsuccessful attempts to say something, offer to return to the idea later. Just tell them, hey, we can talk about that later, or we can parking lot that. Or and only if they're super frustrated, again, would I encourage you to help by giving a good guess. So let's go ahead and summarize. Aphasia, sometimes called dysphagia, the loss of the ability to speak, understand what someone else is saying, or both. A person with aphasia may have difficulty understanding what you're saying, expressing the right words in a thought, reading, writing, gesturing, drawing pictures, or doing math. Sometimes aphasia runs concurrent with other difficulties such as dysarthria, apraxia, or general cognitive impairment. 85% of aphasia is caused by stroke, but aphasia can also be brought on by tumors, brain injury, or neurological diseases. There are several different types of aphasia, be it fluent, also known as receptive, or non-fluent, also known as expressive, or a combination of the two. If you have aphasia, remember, you're not alone. Don't feel isolated. There are millions of people all over the world that are going through the same thing as you are. When you're speaking, try your best to minimize your background noises. Practice, 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 no matter how uncomfortable it may be, and go easy on yourself. It's okay. You've got every day to grow and get better. Join a support group. That's always a surefire way to learn new best practices and to feel comfortable getting out in the world again. If you're helping someone with aphasia, be sure to deliver valid points of the conversation at the beginning of the conversation. Make sure to let them know what you want to talk about. Speak slowly and naturally, but don't talk down to them. Make sure that you encourage that person to communicate. And worst come to worst, if they're very frustrated with what they're trying to say, give a good guess and then step back, wait for them to continue the conversation. If you have any questions about aphasia, feel free to visit the ASHA, ASHA website, and they have a plethora of information if you'd like to learn more about aphasia. Thanks for listening. My name is Whitley Smith. I hope you have a great one.